Greetings and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. And on this segment, we are going to amplify a theme that has gone pretty much unaddressed on this show. Our guest is Michelle Stravitz of Fairfax, Virginia. Michelle has survived breast cancer and continues on that journey, but at some point she saw fit to start up another journey, a journey that can possibly benefit you and or somebody you know. So to learn more, let's get started. And Michelle, welcome to Cancer Interviews.
Thank you. It's so great to be here.
Now, Michelle, the first thing we like to do is let our listeners and viewers get to know a little bit more about you. So we'd like to hear about your life exclusive of your cancer journeys, plural, by telling us about where you're from, what you do for work, what you like to do for leisure, that sort of thing.
Great. So I currently live in Fairfax, Virginia. I grew up in the Northeast, so more like Massachusetts. But I've been down here for over 30 years, and I'm the mother of 4 young adult children, all of whom have fled the nest and are doing their own things. So I'm currently an empty nester. I have a array of different things in my professional background, including management consulting. And I also took off a number of years to take care of my children and raise my family. We also have a dog in our family, and I do spend a lot of time walking my dog. Fitness has been an in and out part of my life. And in the most recent years, I would say I'm pretty into yoga. And that is something that I like to do in my spare time. And I've been enjoying that for a number of years now. And it has taught me a lot more than just the physical yoga positions on the mat. I think it's taught me a lot about mindfulness and meditation and how to think about life. So that's a little bit about me.
Okay, well, you mentioned fitness, and we are going to get into that in depth a little bit later. But I want to next move on to your cancer journey, your first one, in terms of your surviving breast cancer and clashing swords with it. At what point and when, Michelle, did you notice that something physically wasn't quite right and that you needed medical attention?
So in the spring of 2015, I actually found a lump myself in my breast. And I actually went to my doctor and had him take a look. The truth is that when he first felt it or examined me, he told me that it was probably something benign, like a cyst or whatever. And he told me to wait 6 weeks and see what happens. So I did. And in the very end of May of 2015, I came back to him and I said, "It's still there." And he said, "Yep, it is. And it's bigger. And you need to go get a mammogram right away." So as I mentioned earlier, and I'm just bringing this up because I happened to mention it earlier, yoga was a big part of my life. So this was a Friday morning. I was at my doctor's office Friday morning. He got me scheduled for a mammogram that afternoon. And in between, I went to a yoga class to calm down. And it got me through the few hours in between. And then I found myself going through a whole bunch of tests after the mammogram. I think it was pretty clear to everyone in the room. And right away, they did a biopsy. And by early June of 2015, I was diagnosed with triple negative breast cancer, stage 2. Triple negative breast cancer is the one you don't want. It's a very aggressive form of breast cancer. It grows very quickly. It is a lot less common. It's only about 15% of breast cancers. So it was a scary time. It was a really scary time. And as many newly diagnosed cancer patients, I went through a week of intense scans and tests. They were, checking every other part of my body to see if it had spread. They were trying to diagnose it more accurately. And within a week, I had a port put in and I started chemo. So with triple negative, you start chemotherapy right away because it's such an aggressive form of breast cancer. They're very worried about spread. And so they start the systemic treatment first. I did about 20 weeks of 16 different infusions, a lot of chemotherapy, very intense period of time. And then that was followed by a surgery and then a lot of radiation.
What was the worst part of your chemo experience?
Interestingly, I think the worst part, I think there were probably two worst parts. One was the fear before it started. I think the fear before it started was much worse than the actual experience because it was just so scary and unknown. And one of the things that I was very conscientious about, I got a lot of advice from a lot of friends right away. And one of the things that I did was I sort of picked my chemo buddies. I selected a small circle of my world, of my good friends that I chose to bring me to chemo. And for the very first infusion, I actually brought a friend of mine that I knew was not afraid of it, that she would not come to me with that aura of fear because I was so terrified. And so that really helped to strengthen me. So the strength of my friends was really important. But right before starting, I think was a very, very scary time. Once I was in it, I think the hardest part was just the isolation. Cancer can be a very isolating experience. And when you start worrying about your immune system and the germs in the world, you start to withdraw. So, because you're afraid to get sick from other people. And so I had to work really hard to get myself out there and to stay connected. I did feel very supported and connected by my close friends, my larger circle of friends, and really my entire community. It was a time of intense gratitude and support, but at the same time, I did feel different. And I had this sense of isolation.
Now, a couple of other guests that we've had who were diagnosed with breast cancer and went through chemo, they have invoked this term chemo brain. Mm-hmm. And they said, chemo brain, it's real. Would you agree with that? And are you familiar with that term?
I'm completely familiar with that term. I absolutely believe it's real. I would say that I experienced it a little bit during chemo, but during chemo, I actually gave myself a break. I let myself rest. I took a nap almost every afternoon. I took gentle walks. I really pulled back from some of my volunteer commitments. And so I was able to give myself a break. But once I started to get back into life and I expected things to go back to normal, I realized that I really did have chemo brain. I had fogginess. I didn't have the same, what I would call the executive function. It was not the same for me. I worked really hard to evaluate that. I mean, I went and had a cognitive evaluation. I worked really hard to figure out how to get that back. I asked for as much therapy as I could get to do that. And then there are lots of other ways that you can work back from chemo brain. All those things that help with cognitive health help with chemo brain as well. And exercise is a big part of that. And that was part of my personal journey.
Now, there is, I think, kind of a double standard where the following question is coming from, because I think that this emotionally affects women to a greater degree than men. But what was the hair loss piece like in this whole equation for you?
Yeah. This is all new. And it wasn't curly before. So there's an interesting thing. Something that nobody tells you about is that sometimes you get what's called chemo curls and your hair comes back curlier than you ever thought it was. Because of my age, it also came back grayer than I remembered it being. So that was kind of annoying. But the hair loss is a very difficult part of chemotherapy. It is a reality, but it is a very difficult thing. And I always tell, I mentor a lot of women and I counsel a lot of other women who are going through this. And I always tell them that, look, no doubt it's really hard and your hair will grow back. It's temporary. So there are other side effects of chemotherapy that are not temporary, but hair loss is. And, once I knew I was going to lose my hair, I was scared, I was upset, but I was one of those people that chose to take some control. So right away, I cut my hair shorter than it had been so that when it fell out, I wouldn't have these long locks. It would be a little shorter. And then when the time came and the hair started to really fall out and I found it, all over the floor. I remember sitting in a chemotherapy infusion. And when I got up, the hair was everywhere. It was on the floor. It was on the chair. It was on the gown. And I realized it was time. And I went and had my head shaved. So I had already gone and picked out a wig. Again, something I needed to take control of. But it was a difficult experience. But I, again, chose a strong, small circle of friends. And my daughter actually came with me as well. So a few people came with me to that experience. We turned it into a little party and we tried to make it as positive as we could. And it was okay. It was okay. Once I took control and it actually happened, just like the chemotherapy itself, it was less scary than beforehand. I think the anticipation is almost worse.
Now, there is one component in your cancer journey that maybe a lot of other people don't have. You've already mentioned yoga and how maybe it aided things for you when you heard you might be a candidate for breast cancer, but now you're squarely in the middle of this cancer journey. To what extent did yoga help? How did it help?
So yoga helps in a lot of ways. First of all, exercise itself just helps to reduce anxiety in just about everyone. I mean, that's a known fact, whether you have cancer or not. And cancer-related anxiety is tremendous. So it is very, very common among cancer patients, not only during treatment, but well after treatment. Survivorship is its own emotional roller coaster, as all of us who have experienced it know. And yoga is helpful for the movement itself. Actually, I also, because I had a surgery, a pretty large surgery and radiation, and that was personally on my left side, I had a lot of mobility issues. So in addition to physical therapy, yoga was a way of getting my upper body mobility back and moving and stretching on a regular basis. The kinds of positions I was doing in yoga were helping. So from a physical standpoint, it was helping. From an anxiety reduction standpoint, it helps. Fatigue, cancer-related fatigue is also a huge element, and yoga is known to help with fatigue, in particular cancer-related fatigue. So that was really helpful to me. The other thing was, for me, continuing to go to yoga, and I specifically went to more gentle yoga, and I was very selective about where I went. For example, at my regular studio, I didn't go to the crowded classes because, again, I was afraid of the germs, but I went to the emptier classes, and it just made me feel normal. It made me feel like life was continuing. But the most important thing that I think that yoga helps with the cancer journey is that in yoga, as I talked about earlier, it helps me to learn about life. And we talk about staying on your mat. So in yoga, you're doing your positions usually centered on a mat. And it's all about staying in the moment. So you're staying on your mat. You're not thinking about the grocery list. You're not thinking about what you're doing later today. You're not thinking about what you did yesterday or 3 weeks ago or 5 years ago. You're staying in the moment and on your mat. And I do a fairly athletic, intense yoga usually. And that you can't think about anything else except what you're doing when you're doing it. You also have an instructor giving you instructions every moment. So you're just listening to what they're telling you to do right now, even if you don't know what you're going to do in 5 minutes. And for me, that was an excellent metaphor and a life lesson for getting through cancer. A lot of it is just taking one day at a time. And sometimes during treatment, it's 1 hour at a time. And you just have to stay on your mat and stay in the moment. With cancer, we have a lot of worries about the future, right? You go through your treatment, you don't know how it's going to turn out, if it's going to be effective, if it's going to work. And then you go into survivorship and you're always worried about recurrence. But yoga teaches us to stay in the moment. So at the moment, I'm okay. And that's all I know. I don't know what's going to come next.
By the way, if you like what you hear on this segment, we invite you to subscribe to our podcast by clicking on the links below. Once there, you will see a bell icon. If you click on that, we will notify you anytime we post a new interview. Now, Michelle, it sounded like you were making progress in this journey. And I'm guessing you reached a point in which you felt you were starting to get to the other side. What were the indicators of that things were going well and that survivorship, if you will, seemed like a real possibility?
So it's an interesting question. I would say that during treatment, it was, you wait a really long time before you can get your first scans to see, is it working? Is the tumor shrinking? And then it's after surgery, you wait with bated breath, and the waiting is probably the hardest part after those tests. You wait to find out, what did the tests show, right? What was my results? Did they get it all? What did the biopsy show, et cetera? So all of those pathology reports are really, really important and helpful, but you're waiting for them. So each result was a step forward. And then when you finish treatment, there's a little bit of a feeling like you're jumping off a cliff, right? Because suddenly the doctors aren't monitoring you regularly. And to be honest, it took me a really long time to use the word survivor. That was a hard word for me. I didn't want to count my eggs before, they had hatched, right? So I was not using that word for a very long time. I didn't feel like, some people use the term survivor from the day they're diagnosed, right? You're survivor from the day you're diagnosed. And some of us have a harder time using that term because we don't feel like survivors until we get to that milestone where we feel like, are we cured? Did we really make it? Triple negative breast cancer is a very aggressive form of breast cancer. So the first 2 years are very important because the spread is what they're worried about, right? It moves quickly. And so those first 2 years were very difficult. And I absolutely was not ready to use the word survivor. It took me several years before I could do that. But then eventually you start to move into life and feel like some of it's returning and you go back to a little bit more of your routine. And yet you never go fully back, right? You're basically just moving forward and you're transformed. You're different. Once you've had a cancer diagnosis, at least for me, I'll never be the same again.
What are some of the things now you've mentioned that you've done yoga and you've done it at a fairly high level these days and going forward? Are there any things you can't do? Is there any ways in which life changed and it will always be different in that manner?
So I think that functionally, I'm generally back to where I was. I think there's a little bit of, there's still some chemo brain. I don't think I'm the same person. Maybe that's just because, 5.5 years later or whatever, time has taken its toll. I'm aging, right? So that does change. As we age, we also change. But generally speaking, like I talked a little bit about the flexibility. So I can do the same thing on both sides now, which was not the case shortly after surgery. However, it always feels different. So radiation makes permanent changes to your tissue. So I will always have tight tissue on that side. My surgeon told me I will always have to stretch every day, not to get tight. So functionally, I'm doing the same things. I'm back to life. And I'm transformed. I'm a little different.
Now, at some point, and we want to hear about this, at some point you were inspired to take your cancer journey in a different direction, in effect, starting another cancer journey. Tell us about that.
So I think it started during my treatment. And what happened was my oncologist was really clear with me. She told me that, I had a very intense chemotherapy regimen. And she said, the more you move, the better you'll feel. If you can keep moving, you will actually reduce your fatigue. And chemotherapy fatigue is very significant. So I was a rule follower and I did everything she told me, including to move as much as I could. So I learned that exercise was a really important part during treatment. I continued with yoga. I also took advantage of some of the opportunities that were offered at the local cancer support center in my area. I live in Fairfax, Virginia, and there's an amazing cancer support center called Life with Cancer that offered a whole host of exercise classes for people going through cancer treatment as well as long-term survivors. So I took part in some of those classes. Some of them were a little more gentle at the beginning, but it really helped both to get my body moving. And again, then I was surrounded by other cancer patients and survivors, and that felt good because, as I said earlier, it can be very isolating. So exercise was a real important part of my journey. It wasn't until after I finished treatment and I started taking some classes that were for survivors, right? I had a little more time and I wanted to process this for myself. So I took a class on chemo brain and I took a class on the emotional roller coaster of survivorship. And I took a class on nutrition and I took class on looking better after cancer. Every single class that I took told us to exercise. And that really meant a lot to me. And I remember once going to the instructor for some of the cancer exercise classes I was taking. And I said, Susan, do you realize how important what you're doing is? Do you realize what an impact it can have and how it just helps with everything? It helps with the emotional well-being, the physical well-being. It actually reduces your likelihood of recurrence in many types of cancers. So I just said, do you realize this is so incredibly important? So the importance and the benefits of exercise really came into light for me. And then in addition, I had a very significant feeling that I had, at least for now, survived a life-threatening illness. And I needed to make my life have meaning. I needed to do something important. And I was at a time in my life where I really wanted to make an impact anyway. Like I wanted to, leave my footprint on the world in addition to the children that I had raised. And so the ideas started percolating. And after some time in early 2017, I got together with a friend who was also a cancer survivor. And we started talking about how we might help. Now, my co-founder of the organization I ended up putting together, Two Unstoppable, she was a total fitness enthusiast. I mean, she's someone who runs marathons. She's a gym rat. She works out every day. She's high intensity. And I was someone who had, fitness was in and out of my life. I was more of a yoga person. I did bar. I liked various forms of exercise, but I wasn't so intense about it. And so we had two very different relationships with exercise, and yet it had been part of both of our cancer journeys, very much so. So we started talking about what we might be able to do. And we looked back on something we had done together, which is that when I was in treatment, I had a whole lot of friends who said, what can I do for you? And often I would say to them, well, you just come walk with me. I need to take walks. I have a dog. I need to walk the dog. I need to do it for myself, as my doctor has told me. But during chemotherapy in particular, I was a little afraid to walk alone sometimes. I was afraid of what if I lose balance or I don't feel well? I'd rather have someone with me. And so this friend, Ilana, would come and walk with me. And while we walked, we talked. And I could ask her, what was your lumpectomy like? And what was radiation like for you? And do you have any tips on getting through it? And similarly, I had actually had another friend that I got in touch with during chemotherapy, and she was also unfortunately going through chemo. We found each other at the Cancer Support Center and realized we were both going through it. And every Friday morning, she would come to my house and we would walk together. And that was a peer-to-peer conversation, right? We were just going through a lot of the same things. We were going through life milestones, and we would walk and we would talk. So we provided both physical and emotional support to one another. And I can tell you that there were many Friday mornings where if she wasn't showing up at 9 a.m., I probably wouldn't have gone out. But because she was there, I walked also. And not only did I walk, but I walked longer than I would have walked on my own. I might have gone for 15 minutes if I was by myself, and maybe I would walk for 40 minutes with my friend. So we had that experience together, and we realized the power of the buddy system. And if you look, you do a little Googling, you'll find out that there's a ton of research that says that if you have a fitness buddy, you're more likely to be motivated, you're held accountable, you're more likely to get out there and exercise, you're more likely to maintain an exercise routine, you're more likely to work harder and longer and more often. So, we put together the need for physical and emotional support. We put together the research on fitness buddies, and we started to formulate this idea for a fitness buddy matching program. I had, at that point, already started mentoring a number of other women that were getting diagnosed. In particular, because triple negative breast cancer is so unique and different and extra scary. When someone gets diagnosed with triple negative, they want to talk to somebody else who had triple negative, not other types of breast cancer or other types of cancer. So I had already been experiencing the power of mentoring and peer supporting other women who had triple negative. And so I understood the power of that peer support as well in that respect. So we put it together and we started talking. And basically in 2017, we founded a nonprofit called Two Unstoppable. And the number 2 is really about that buddy system. And over the years, it has evolved in not only offering a free online fitness buddy matching program, which is basically just like a match.com for fitness buddies for cancer survivors and patients, right? You can find your fitness buddy. But we've also gotten into education. We offer classes and we offer an online community of women looking to stay active. So we're working really hard now over these number of years to help inspire and support women with a cancer diagnosis to get moving and stay strong.
Now, we've talked about, Michelle, we've talked about the side effects that were part of your breast cancer journey. With the power of exercise, what side effects can be addressed via exercise?
So there is a whole host of side effects that can be addressed through exercise. We've talked about chemo brain that can be helped. We've talked about tightness. Many women and men experience bone density issues as a result of chemotherapy and other treatments. So I know that was an issue for me. And exercise, especially weight-bearing exercise, helps with bone density issues. We talk about balance issues that happen as a result of various types of treatment. A lot of people lose strength in their core, especially if they've had abdominal surgeries and they need to work that back in. Chemotherapy also takes an unbelievable toll on your muscle mass. One of the statistics that actually really got me moving personally, in addition to my doctor's advice, was that I learned that in the course of 10 years of natural aging, all other things being equal, we will typically lose about 3 or 4 pounds of muscle mass just from aging. You can lose that same amount of muscle mass in 6 months of chemotherapy. So that to me was really dramatic. It sort of said, I've aged 10 years of muscle mass loss in just the 5 or 6 months that I had chemotherapy. And so it's very important to also include in the exercise strength and resistance training. So you need to build back that muscle. And it's important to build back that muscle. In addition to the kinds of side effects that I just talked about that are physical, there is, as we talked about, cancer-related fatigue. Now, this can be from your treatment, things like surgery, radiation, and of course, chemotherapy that cause fatigue, but it's also just the worry of having cancer, the fear. It's exhausting. It's emotionally exhausting. And so there's this whole range of causes of what they call cancer-related fatigue. And do you know that exercise is the number one treatment for cancer-related fatigue? It's the best way to combat that fatigue. So there's a side effect that's really helped. And then the other thing is just the emotional side. Anxiety and depression are incredibly common with people with a cancer diagnosis. It often sets in survivorship, even more so than during treatment. And that anxiety and depression can also be treated by exercise, by just getting the adrenaline going in your body and getting those endorphins going. That can be really helpful. So it's physical, it's fatigue, it's emotional. All those are side effects that can be addressed with exercise. And this can be in the recovery mode where you're trying to get them back, get back from it. It actually also helps to mitigate those side effects while you're in treatment. So if you're lucky enough to have a little time before a surgery, for example, they now do something called prehab, where they're working you up, and a physical therapist can work with you to do some exercises to prepare you for surgery so you have less of an impact on your body when you have that surgery.
Our guest is Michelle Stravitz of Fairfax, Virginia. And on this segment, we're talking about cancer journeys, and we're talking about exercise and the melding of the two. Now, Michelle, there are many different types of cancer. We can't go through all of them type by type, but generally speaking, would you say that exercise is safe for cancer patients during treatment? We've talked a little bit about before treatment and after, but what about during treatment? Is it safe at that time?
Yeah. So every case is different. Every person's cancer case is different, and every cancer is different, and every treatment is different. So we always say that you need to check with your doctor. You should always get a doctor's clearance on whatever type of exercise that you're doing before you get started. And you need to, it's ideal if you can be working with a cancer certified fitness professional. So there are actually certifications like the Cancer Exercise Specialist certification through the Cancer Exercise Training Institute. And that's just one example where you have a fitness professional who's trained in working with a cancer patient or survivor. So they not only are familiar with the treatment you're going through, but also the side effects you might be experiencing, and that helps to make it safe. So in general, there is a safe way for everyone to exercise during treatment and after treatment, but you have to get some guidance. You have to know what you're doing. And Too Unstoppable actually has a whole section of our website called resources with a lot of information and guidance to help you find that for yourself. And again, you always want to ask your doctor. But in terms of like what types of cancers are most impacted, which ones are safest, there's been a lot of research. There are 13 types of cancers where it's demonstrated through research that the exercise will help combat the side effects, reduce recurrence, increase survival rates. The top 3, breast cancer's at the top. So for breast cancer patients, those women who exercise regularly after a cancer diagnosis have a 40% better survival rate. They are 40 to 50% less likely to have a recurrence, and similar numbers less likely to die from other, related causes. For example, cancer treatment can affect your heart. So if you can work on your heart health, that'll help prevent problems later on that were sort of side effects of your cancer, right? But that can cause health problems later on.
By the way, Michelle, you'd mentioned your website. And before we go any farther, let's get that web address out there. It's the number 2, then the word unstoppable, 2unstoppable.org. 2unstoppable.org. That's almost a one-stop shop for so many things relating to cancer and exercise. And speaking of exercise, Michelle, obviously we can't go through the entire list because there are many types of cancers, many types of side effects. Each one is their own equation. But if you could just pick off the top of the list, just to give listeners and viewers an idea, give us an idea of a couple of exercises that you would recommend.
So the general guidelines from the American Cancer Society are your target should be trying to get 150 minutes a week of moderate to vigorous exercise. Now, the interesting thing is this is actually the same recommendation for the general population. So every adult should be getting a similar number of minutes, if possible, of exercise a week. What does that break down to? It can be 2 75-minute exercise sessions. It can be 5 30-minute ones, or you can do that 2 minutes at a time. We talk about something called incidental exercise, which is ways of getting a little extra movement in throughout your day. So take the stairs when you can, walk down the hall when you can, park a little further away when you're going to a store. All those ways to get moving are ways to get incidental exercise, and they all add up to that 150 minutes. What does it mean, moderate to vigorous exercise? It means you can talk, but maybe you can't sing, right? You're getting your heart rate up a little bit, but you don't have to be huffing and puffing. You don't have to be sweating in the gym. It's just a way to get moving. Now, in addition, we strongly recommend a couple of times a week, including some strength or resistance work, right? Some sort of weight-bearing exercise, doing some strength training. Again, every person's different. Every person's case and treatment are different, and their limitations are different. And so you, of course, need to make some accommodations. Now, within those guidelines, I do always tell everyone, this is not all or nothing. 2 minutes is better than 0 minutes. So if you can't get 150 minutes feels very daunting to many people. It's okay if you can't get that 150 minutes in. Get as many as you can, because every minute that you're not laying on the couch and you're moving is a good minute of exercise. And so whatever you can do to get your body moving, and what you'll typically do is work up to it. There are some modifications on the recommendations that if you're in heavy treatment, 75 minutes a week can be okay. And if there's a day when you can't even walk to the mailbox, take a day off. It's okay. You don't have to push yourself beyond your limits, but do what you can when you can. Now, the other thing that people often ask is, what's the best form of exercise? Like, if I have to pick one, what's the best form of exercise? The answer is The best form of exercise is the one you're going to do. So if you love belly dancing, that's what you should do. And I've tried it. It's incredibly fun and liberating, and it's a great workout. If you love yoga, there's all different types of yoga. Find one that works for you. If you love walking, walking is an amazing, really impactful form of exercise. And it also often gets you outside. It can be what's called a mindful meditation. It gets you out in nature. It might even be social, as I talked about, if you can walk and talk with a buddy. So walking is a great form of exercise. And if you love to run, go at it. But whatever works for you is what is the best exercise for you to do, because that's the one you're going to keep doing. We're not talking about exercising for a week or two. We're talking about getting your body moving for the rest of your life.
Now, Michelle, a lot of the forms of exercise that you've referenced here are things that a lot of people do, whether they're in a cancer journey or not. But in terms of Two Unstoppable, your organization, what does it do? What does it preach to cancer patients that is unique to cancer patients?
So Two Unstoppable is unique in a number of ways. When we actually founded Two Unstoppable back in 2017, we did a little bit of research. And what we learned is that there are organizations that provide exercise classes to cancer patients and survivors. If you're lucky enough to live near a really great support center that has them, or a hospital that offers them, there are some amazing cancer exercise programs out there. There are fitness buddy matching programs out there, for example, in the world. There's a way to find a fitness buddy, but there's no program that's offering fitness buddies for the cancer community specifically. And the benefit of that is that you're both working on some of the same goals. And you can find a fitness buddy that works best for you, right? Someone who likes the same kind of exercise as you, or maybe had the same kind of diagnosis as you, or maybe they're at the same stage of life as you are, or maybe they're in the same geographic location as you. And that's important. So you can find the buddy that works for you, but that's unique, finding a fitness buddy that has also been through the cancer journey, because as I said, cancer can be very isolating. And the social support component is very, very important. And nobody gets it like someone else who's had cancer. So that is something that we offer that is definitely unique. Another thing that we're doing that is unique is we actually just, we have launched a really a wildly successful program called Two Unstoppable Strong, which is a group progressive exercise program specifically targeted for women who have had a cancer diagnosis. And we have different groups and different sessions. Some of them are specifically for people who are in the first year after completing treatment. So they've completed active treatment, but they are still within that first year. And as I said, that's a year when you kind of feel like you're jumping off a cliff. And it's a scary time. It's also a time where the doctors are done providing your treatment and you're looking to what you can do to take control, right? What can I do to help my own outcome? So it might improve my chances. It also just might improve my quality of life. So Two Unstoppable Strong is offered to a group of women who have completed treatment. We also have a special session that we offer for women who have metastatic cancer, because those women need a different set of accommodations and a different set of modifications, and they have a different set of goals. So there are lots of different programs like that, but it's a progressive program. A lot of cancer support centers offer a drop-in kind of class so people don't have to make a commitment. But when you do a progressive class, you're all growing together and improving your capabilities together, and you can really see those results.
All right, Michelle, we're going to bring this to a conclusion, but I want to conclude this with the following question. Your website, and again, that's unstoppable.org, twounstoppable.org. Your website lists a whole bunch of reasons to exercise. But yes, if you could pluck from all those reasons, one that is the most important reason, one overarching reason that you would like to leave a listener or viewer with, what would that be?
The most important and the best reason to exercise is the reason that gets you moving. So it's whatever puts the fire under your belly. So whether it's to combat the side effects, to help with your recovery, to reduce your chances of recurrence, to increase your chances of survival, to reduce your own anxiety, to reduce your own fatigue, to get back your muscle mass. Whatever your reason is, that's the best reason to exercise, because that's the one that's going to keep you moving.
Fantastic. Michelle, just a wealth of information from you. And again, you have brought a different approach to the cancer journey, different from any that we've had on any of our other interviews. And that all by itself makes this interview very significant, because it can resonate with a lot of people. And again, if somebody is watching or listening right now, and thankfully they're not in the middle of a cancer journey, they may know somebody who is, and this can benefit them. So Michelle, one more time, that web address, 2unstoppable, the number 2, the word unstoppable.org. Check it out. There's plenty of information that can be beneficial to you. So Michelle Stravitz, one more time, thanks so much for being with us.
Thanks for having me. Keep moving and stay strong.
And that's going to wrap up this section of cancer interviews. We hope what you heard can be beneficial. Until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.